Hello guys, good morning. Myself Monica, lecturer in Rama College of Nursing, Rama University, Kanpur. Today we are going to discuss about cerebrovascular accident. Cerebro, it is in the brain, the cerebral part, the vascular, the blood vessels, and the accident which occurs to the brain we are calling as cerebrovascular accident, and it is also called stroke. When the blood supply interruptions or the disruption of blood supply occur to the brain, there is a clot or there is a hemorrhage, we are calling as a stroke. As a definition, it is given by Brother and Siddharth. So, it is an infarction of specific portion of brain. So, infarction is a death of a cell tissue or death of any blood vessel we are calling as infarction of specific portion of brain due to interruption of blood flow. So, when the blood flow is getting interrupted due to any of the thrombus or emboli or any oxygen supply is getting disturbed, so that there is an interruption of blood flow that results in loss of brain function. So, the brain function is getting lost and it causes a CVA. It is called as a cerebrovascular accident. So, this is a definition of CVA. It is an infarction of specific portion of brain due to interruption of blood flow that results in loss of brain function. So, here we are having two types, mainly the ischemic and hemorrhagic. So, the ischemia is nothing but a clot formation, or when the patient is not having proper oxygen supply in the brain, we are calling as ischemia. And hemorrhagic, due to rupture of any blood vessel, we are calling as hemorrhagic. So, in first is ischemia, ischemic stroke. So, these are types of CVA, ischemic stroke and hemorrhagic stroke. So, as I told, ischemic stroke is nothing but when the blood flow in the blood vessels is getting obstructed. If it is a artery or it is a vein or a blood vessel, what happens here? Here there is a supply of blood. So, when the blood flow is interrupted due to less oxygen supply, like anoxia will occur due to any thrombus or embolism. So, thrombus is a blood clot. So, we can see embolus is nothing but moving clots. Okay. So, here the oxygen supply is getting disturbed and there is a chance of occurring of ischemic stroke. Hemorrhagic stroke is nothing but when there is a rupture of any blood vessel or the arteries or the veins, we are calling as a hemorrhagic stroke. In a ischemic stroke, again we are having four types. In a ischemic stroke, we have again four types: large artery thrombotic stroke, small penetrating artery thrombotic stroke, cardiogenic stroke and cryptogenic stroke. So, first one is large artery. So, by name itself it is telling us large blood vessels. So, when the large blood vessels are occurring by the clots like a thrombus or embolism or plaque formation in the large arteries, we are calling as large artery thrombotic stroke. The stroke will be occurred in the large arteries. Then is small penetrating artery. In name itself it is telling us small. So, the small blood vessels are occurring with the due to less supply of oxygen. The stroke will be occurring due to less supply of oxygen in a small blood vessels, we are calling as small penetrating artery. Then is cardiogenic stroke. As the name itself it is telling as cardiogenic stroke. So, the cardiac arteries, the major cardiac arteries which is connected to the brain and the heart, we are calling as a cardiogenic stroke, will be occur when the cardiac arteries and the veins is getting blocked, we are calling as cardiogenic stroke. That is cryptogenic stroke. So, there is no cause for the stroke which is occurring in a patient with the cryptogenic stroke. That is what, like another disease conditions, like the patient is taking like anticoagulation medications or the patient is taking like any high dose of drugs or any type of disease condition which will be causing as a cryptogenic stroke. So, these are four strokes which will be coming under ischemic stroke. So, in a ischemic stroke we have large artery thrombotic stroke, small artery penetrating thrombotic stroke, then cardiogenic stroke and the cryptogenic stroke. Now, we are moving to the hemorrhagic stroke. We have primary and secondary. In a primary it is a starting stage, right. So, in a primary, normally the patient will have the cause of uncontrolled hypertension. So, hypertension is nothing but increased blood pressure. So, here when the increased blood pressure is not controlling or it reaches to 200, 400 or the patient is having increased pressure in the brain, we are calling as a primary hemorrhagic stroke. And the secondary hemorrhagic stroke is associated with the different disease conditions like intracerebral hemorrhage, then we have intracerebral aneurysm. So, aneurysms is a dilation of any arteries and the veins, we are calling as aneurysms. So, these two associated factors are causing for a mainly secondary hemorrhagic stroke. So, these are two types of a hemorrhagic stroke which will be causing a stroke in a patient with the CVA. And we are moving to our next is hemorrhagic stroke other types. So, we are having other types of hemorrhagic stroke. So, which causes a damage to the rupture of a brain. So, other types are, so first one is intracerebral hemorrhage, then subarachnoid hemorrhage, then we have intracerebral aneurysm. So, these are other types which will be coming under hemorrhagic stroke. So, intracerebral hemorrhage. So, within the brain tissue we are calling as, when the hemorrhage is occurring within the brain tissue we are calling as intracerebral hemorrhage. Then subarachnoid hemorrhage, as we know the subarachnoid space, dura mater, pia mater and arachnoid space. So, in between the subarachnoid space if the hemorrhage is occurring due to increase in like blood pressure. So, then is intracerebral aneurysm. So, aneurysm already I have told it is a dilatation of arteries. So, these arteries are mainly get dilated and it gets ruptured, that is what intracerebral aneurysm. So, this aneurysm, in the aneurysm like this, if it is a normal vein or the artery, here there is a aneurysm will be occurring like this as the dilation will be occurring in the arteries and it causes rupture of a blood vessel. So, then is fourth one is atriovenous malformation. So, atriovenous malformations is nothing but malformation it is occur due to birth or it is like a congenital anomaly. So, atriovenous malformation is nothing but it will like be tangle formation. So, here like this arteries and the veins get together which will be like tangle position. It may cause rupture of a blood vessel when it gets tightened and the pressure is getting more. So, we are calling as atriovenous malformation. These are some of the types which will be occurring in the CVA. So, we have seen two types like that, ischemic and hemorrhagic stroke. In ischemic again we have seen large artery, small artery, cardiogenic and the cryptogenic stroke. In hemorrhagic we have seen again primary and secondary, in that intracerebral hemorrhage, subarachnoid hemorrhage, intracerebral aneurysm and atriovenous malformation. Moving to our etiology. So, etiology is a common for both the ischemic and the hemorrhagic stroke. So, like the thrombus or atriovenous malformation or aneurysm, like this some of the causes are there in a patient with the CVA. So some of the causes like thrombosis, then we have atriovenous malformations, then we have vascular compression, and cerebral aneurysm. So, these are some of causes which will be affecting a CVA and it causes a stroke. Moving to a pathophysiology, we are having two pathophysiology, one for ischemic and one for hemorrhagic stroke. So, as I told, ischemia is caused by decreased oxygen supply and destruction or disruption will be occur within the cells and the cells will not get enough production of blood supply. There is a death of a cell and the tissue is getting necrotized and it causes energy failure and causes ischemia. So, we can see here due to etiological factors like we are taking of thrombosis. Due to etiological factors like we are taking of thrombosis or thrombotic clot. So, here there is a disruption of blood supply So, when there is a disruption of blood supply, if it is an artery like this, so when the flow is good, normally the brain function will be good. Now the flow is interrupted. Here the oxygen is getting low. So it is getting decreased. Oxygen is getting decreased. When it is getting decreased, so there is a disruption of blood flow. So there is an increase of intracranial pressure, which leads to obstruction occurs due to plaque or like thrombotic or embolism. Obstruction will be occur. So when the obstruction is occur, the oxygen is completely getting disturbed. So there is no supply properly. So when there is no supply, there is a cell function diminishes. So when the cell function diminishes or the cell function is disturbances will be occur. So there is a chance of necrotized tissue in brain, which cause energy failure and which cause ischemia. So this is what regarding of ischemic stroke. So as I told, ischemia is caused due to of disruption of blood flow and the oxygen supply is getting decreased. So there is a obstruction will be occur. So there is a cell function within the tissue or within the artery, the cells are getting damaged and there is no function properly. It causes necrotizing of like different areas of the brain, which will be causing of energy failure and it causes ischemia. So moving to a hemorrhagic stroke. Hemorrhagic stroke, as I told, it is a rupture of a blood vessel. So how the rupture is getting occurred? So as I told, due to the any etiological factors, like if you take as a thrombosis is a etiological factor, due to that there is a pressure, increase in pressure of a like a aneurysm also if we take. So there will be a like if we take like this, the aneurysm, this is an aneurysm. So now it is getting dilated. So this is one example I am telling in the pathophysiology. So when the aneurysm is occurring here, so there is a dilation will occur. When the dilation will occur, there is a automatically rupture of blood vessel will occur. So when the rupture of the blood vessel is occurring, automatically the blood will ooze out and the blood oozes in the brain, in the subarachnoid space maybe or the arachnoid space maybe, in the brain tissue the rupture will be occur and causes stroke in the patient with the hemorrhagic stroke. And moving to our next is clinical manifestations. So as we know, clinical manifestations are different. It will be related to your neurological condition. So first one is visual field defects. Clinical manifestations. So first one is visual field defects. So by name itself it is telling as visual field. So due to of visual, like in a neurological system there is also cranial nerve function. So in that also optic nerve, oculomotor, we have different cranial nerves. So the cranial nerves are affecting here, like sensory and the motor nerves are affecting mainly. So here the visual field defect is nothing but the patient may have diplopia, like double vision the patient will have, and the patient cannot see properly. The patient will have a numbness and tingling sensation, or the patient will have a blindness. So visual field defect is the first one, and the second one is motor deficits. So in motor deficits we can see hemiplegia, paraplegia, or the patient is having paresthesia, or the patient is not able to move from the bed, we are calling as a motor deficits. And the sensory deficits, like the patient is not able to move, or if we give any pain also the patient is not having any pain sensation, will not be there to the patient, like paresthesia, weakness will be there to the patient of in arm, hands and the legs, that will be seen under sensory deficits. And we have a verbal deficits. So in verbal deficits, as we know, verbal is nothing but talking. When the patient is talking properly, he cannot form the words, or he cannot spoke the words properly, or he can utter the words and he can not form the words properly, we are calling as verbal deficits. And we have cognitive deficits. So cognitive deficits is nothing but intellectual power. The intellectual power is getting reduced, like intellectual power, judgment or order, like sensory, everything will be coming under cognitive. The memory loss will be there for the patient and he is not able to recognize the past things, that is what cognitive things. So these are some of a clinical manifestation which will be occurred for both the ischemic and the hemorrhagic stroke. Moving to our diagnostic findings. So normally we have history collection and physical examination. So, common in all disease conditions. History, like previously he is having any accident, or the previously he is having any family history, or he is having any injury, falls will be occurring in the history collection. Then we have a physical examination. Normally in physical examination you will see the patient condition like appearance. Head to foot examination can be done in a physical examination, like you will see the numbness, the sensation, or the patient is having motor activity, abduction, adduction, flexion, whatever may be, the physical examination is done. Then you have a neurological examination. This is a common in all the nervous system disorders. So, neurological examination, in a neurological system we have like 5 aspects, like level of consciousness, cranial nerve functions, then we have reflexes. Okay. So, these like will be included in the neurological examination, as we are assessed to see the patient condition is normal or abnormal. So, then we go for CT scan, as the brain having the clot or the hemorrhage is occurred, so that we will be observing of in the CT scan where the clot is occurred in the particular tissue or the particular brain part we are observing, that is what CT scan. Then MRI scan, then we have biopsy. So, if it is like any tumors and all, we can send for an investigation like biopsy. Then we have CT angiography. So, as I told, angiography is nothing but by under the observation of CT, the dye is introduced. So, the major artery, the dye is introduced into the brain in order to know where the clot actually occurred. So, that is what CT angiography. So, these are some of the diagnostic findings which will be seen under cerebrovascular accident. Moving to our management, here we have medical management, surgical management and nursing management. So, in medical, medical means we have like drugs. So, pharmacological management, we are giving mostly the like anticoagulant drugs like warfarin you are giving, and if a patient is having like seizures or epilepsy, we are giving anti-epileptic drugs, like we are giving like phenytoin, and we are giving of anti-epileptic drugs. Then we have giving for pain like analgesics, if we are giving like ibuprofen can be given to the patient, and mostly in a in ischemic. So, recombinant TPA is a drug. Recombinant TPA is a drug which will be used for a reducing of a thrombosis. We are giving of this will break the clot. We are calling as recombinant TPA. This is 0.9 mg per kg we are giving to the patient in order to reduce the clot formation or destruct the clot. So, that is what main drug which will be used for in a ischemic, or other drugs are common in a hemorrhagic also. And moving to a surgical management. So, surgical management, as we know, it is some surgeries are there for the ischemic and hemorrhagic. So, for first is ischemic. Already I have told you, in a ischemic the surgeries include carotid endarterectomy, then carotid stenting. So, these two main surgeries are done in a ischemic condition. So, ischemic stroke. So, carotid endarterectomy, as I told, the major carotid artery, if it is getting blocked with the plaque, or if it is blocked with a thrombosis, or it is blocked with the emboli, so we are destructing or we are removing this formation, like removing of a plaque. We are nothing but a carotid endarterectomy. We will be opening of a major carotid artery and we are removing of that particular object which is obstructing in the arteries and the veins. We are calling as a carotid endarterectomy. Then carotid stenting. So, stenting is nothing but a stent, metal sheet is placed in order to reduce of a clot. We are calling as a carotid stenting. And moving to a hemorrhagic surgeries. So, we are having two surgeries here mainly. In hemorrhagic stroke, we have first one is craniotomy. So, then second one is extracranial and intracranial. extracranial and intracranial bypass graft, arterial bypass graft. So, here two main surgeries are there. So, hemorrhagic, as we told, the rupture is there in a major artery. So, craniotomy, you will see by opening of a brain, and we will see where the rupture is occurred. It is in subarachnoid space or pia mater, or it is like a like any other place in the brain. We are calling as a craniotomy, which will be seen the hemorrhagic place. Then is extracranial and intracranial. So, extracranial outside of a brain like a tissues. So, intracranial within a CSF and anywhere in the brain we are calling as intracranial. So, with both this, if a clot or the like any bleeding is occurring, so arterial bypass graft is done in order to reduce of a stroke or a hemorrhage. Then we are moving to a nursing management. So, nursing management, as a nurse, how she have to care for? First of all, she have to assess for a or assessment. So, assessment is nothing but you will be assessing the patient. So, how she will assess a patient? Now, here in a assessment, she will be assessing for a neurological condition. First of all, she have to assess for all the cranial nerves. She have to assess for Glasgow-Coma scale, GCS, that is like 14 scoring, that will be checked by a mild, moderate and severe. Then you will check for reflexes, whether the patient, like we have told, the patient is having hemiplegia, paraplegia or hemiparesis, or the patient is having paresthesia. The reflexes must be checked within a assessment. And normal condition, the patient is having normal condition or not appearance must be checked in the nursing management. Mostly you will be observed the patient will have a convulsions also, that will be included in the nursing management. Moving to our complications. So, the complication mainly CVA itself, it is a major complicated case. So in a complications, first one is cerebral anoxia. So, anoxia is nothing but there is no oxygen complete supply to the brain, we are calling as a cerebral anoxia. Then vasospasm, there is a constriction of a blood vessel, we are calling as a vasospasm. Then is increased intracranial pressure. So, this is main that if the pressure is getting increased, the patient will have a complete damage of a nerve. So, the arteries we are calling as a intracranial pressure. These are some of our complications which will be done under cerebrovascular accident. Moving to a conclusion, we have discussed regarding definition, types and ischemic and hemorrhagic types, two types. So, in this we have seen a different types again, etiology, pathophysiology of both the types. Then we have seen clinical manifestation, diagnostic findings and management, and the complication is done.